what the federal government can do and what we're doing is to incentivize, and I mentioned that in the course of my address. We can encourage governors by saying, if you do this, we will support you with this, including even the local government level of government. We are also, of course, going to ensure that our activities is not restricted to major cities, even at the federal government level. We can also carry our activities to the suburbs. More importantly, is for us as citizens to also continue to challenge our political leadership and make health issues political issues, health issues campaign issues. Because it is when we are able to challenge our leaders and hold them accountable to whatever promises they make in the course of their campaign that we can actually ensure that what we need is done. So the federal government beats, but we also have some responsibility to hold our leaders to account. Now, with respect to my essay, because I like full disclosure, I don't want you to go and get somewhere that the minister made his essay chairman. That's why I said it. Because when he brought the list to me, the first question I asked is that, why are you making my essay the chairman? But I must tell you, it's been an essay to the minister should not be a disadvantage if he's qualified.
Correct.
It shouldn't be a disadvantage. The fact that it's my essay, if he's qualified, do not disadvantage him to be appointed into a position that is qualified. He's one of the people that the federal government trained in nuclear medicine. More than 50 or 60% of them have jackpot. He has stayed back in Nigeria. I know his antecedents as a consultant oncologist who has worked at the federal government level before I appointed him as an SA. So in terms of qualification, he's well qualified, But more importantly, he's also able to help us within the policy space, because he's working directly within the policy space in terms of facilitating a lot of things that the committee will need in getting their work done. So I believe that being qualified and having that advantage of working in the policy space put him a little ahead of any other person to chair that committee. Yes, we continue to battle with the challenge of JAPA, and as you must be aware, the federal government is very robust in addressing this problem. You must know that we have a engagement. Since I became Minister of State for Health, I must have engaged Nigerians abroad at least 3 times, in America, in the UK, in Ireland, and we continue to engage ourselves. And the whole essence of the engagement is to also ensure that even when they are not here physically, they can also be useful to what we do, So we continue to engage them, and of course, telemedicine is one of the spaces that we can explore to engage the services of our professionals in diaspora. But more importantly, we have decided to prioritize prevention, because it is when we focus more on prevention that we can actually significantly reduce the burden of cancer in our country. So our priority is more to focus on primary prevention and secondary prevention through screening, through immunization. So you see a lot of efforts within that space. Yes, clinical trial and local production of cancer drugs. Well, we will continue to try our best. I'm just being informed that at the moment, there are at least 30 clinical trials that are ongoing in Nigeria for various diseases. That's according to NAFDAC. But you must know that clinical trials are very expensive and very laborious. Takes time. We try as much as possible within the economic ability of the country that whatever drugs we want to localize, we also do some level of, it may not be a full-scale 100% clinical trial. Some level of trial is done, especially for such specialized medications for cancers. But more importantly, I think the approach of targeting the genetic makeup of the kind of cancer that each person has will also help us treatment better. And we are scaling up our ability to do that through our immunochemistry program. The Renew Hope agenda has a central placement for healthcare and treat the health of Nigeria and treat the health of Nigerians as an urgent matter of rights. In consonance with this, the health vision of Mr. President is resting on unique 4 pillars, including improving healthcare governance, including improving population health outcomes, unlocking healthcare value chain, and health security of all Nigerians. Using this blueprint, the Federal Ministry of Health and Social Welfare has recorded several unique achievements in our quest to address cancer challenges in the country, ranging from primary prevention through vaccination, early detection, prompt treatment, and the expansion of the research space. It is pertinent to know that the National Primary Healthcare Development Agency is leading the Human PanamavirusVaccination for primary prevention of cancer of the cervix, as well as the hepatitis immunization for the prevention of liver cancer, thus focusing preventive activities on the 2nd and 4th most common cancers in Nigeria. While the vaccination for the viral hepatitis has been on the National Program of Immunization, HPV vaccination was commenced in 2023, and it is heartwarming to know that we have successfully immunized over 12 million girls for human papillomavirus, and effort is ongoing to improve on the successes recorded so far. I hereby enjoin parents, opinion leaders, and indeed all stakeholders to take advantage of the immunization program to prevent these vaccine-preventable cancers. The Nigerian government is also exploring a unique approach to cancer care through health insurance coverage for cancers. In accordance with the National Health Insurance Authority Act 2022, the National Health Insurance Agency has developed a robust concept note and implementation plan for catastrophic health insurance, which shall support patients with end-stage renal diseases, sickle cell disease, and cancers. The catastrophic health insurance will benefit from the Basic Health Provision Fund and other funding mechanisms within the NHIA. The Ministry of Health will give NHIA all the necessary support to seamlessly implement the catastrophic health insurance. It also is pertinent to note that the Federal Ministry of Health and Social Welfare is upscaling its efforts to improve access to cancer care services in all the federal tertiary hospitals for prompt diagnosis and comprehensive treatment. I'm happy to announce that sequel to the approval of Mr. President, we have finalized plans to establish and upgrade 6 federal teaching hospitals with new radiotherapy and nuclear medicine facilities across the country. Thank you. 3 of the centers are planned to be commissioned in May 2025, and the remaining 3 will be commissioned on or before 2026 World Cancer Day. We intend to sustain this initiative throughout the lifespan of this administration, so that before 2030, every part of this country will have been equipped to treat all forms of cancers. This is our unique strategy to attain the WHO global target of eliminating cervical cancer and other preventable cancers by 2030. The National Institute of Cancer Research and Treatment, NICRAT, is working to ease access to the Cancer Health Fund and expand the scope in terms of the types of cancers covered and the health institutions where they can be assessed. In the 2025 budget, the agency has proposed a major increase in the volume of funding available. NICRAT has also initiated reforms to formalize and harmonize cancer registries across the country to create a unified, government-operated, digitally enabled platform that enhance data collection, surveillance, and research in line with international standards. The agency is also working with our hospitals to upscale the provision of clinical preventive services for cancer. Apart from these diagnostic and treatment services being implemented by our agencies, the Ministry, through the National Cancer Control Program, continues to deliver on its responsibility of developing relevant policies and guidelines for cancer prevention and control in Nigeria in line with the National Health Act 2014. We shall continue to engage state ministries of health through the National Council of Health to ensure optimal uptake and implementation of the various policies in order to achieve cancer-free Nigeria. Ladies and gentlemen, one of the major areas of disease management, including cancer care, that we are lagging behind is in the area of nuclear medicine services. As a country, we developed a very robust initiative, including partnering with the International Atomic Energy Agency, to develop nuclear medicine program in Nigeria. The National Nuclear Medicine Management Committee that was set up by the ministry in 2010 did their best and facilitated training of several nuclear medicine physicians and other allied health care professionals. However, due to lack of requisite infrastructure and continuity, we have lost most or more than half of the trained physicians to other countries. In our commitment to ensure health security, I have approved the reconstitution of the National Nuclear Medicine Technical Working Group to serve as an advisory body to the Ministry on development and implementation of nuclear medicine services in our country. This will also strengthen our collaborative efforts with the IAEA and other international agencies. As part of the 2025 World Cancer Day commemoration, it is my pleasure to inaugurate the newly constituted NMTWG, carefully selected to involve nuclear medicine physicians, relevant training regulatory institutions and agencies involved in cancer care, financing and research bodies, civil society groups, equipment manufacturers, and other relevant professional bodies and cancer advocates. The technical working group is to be chaired by Dr. Ololade Kehinde. Please stand up, Dr. Kehinde. Dr. Ololade, please stand up so that everybody can see you. Thank you. Who is in Detale is one of the nuclear medicine physicians that the ministry trained. So we're not allowing somebody to take over our program. So he will act with the National Coordinator, National Cancer Control and Nuclear Medicine Program, serving as the Secretary and Head of the Secretariat for the effective feedback to my office. In addition to that, Dr. Aliko Shindu, who is a nuclear medicine physician at UPTH Port Harcourt, to serve as co-chairman. So we have tried to blend the policy side and the research side, so that first with Dr. Ololade, that is my essay, but I must tell you that he got it on merit. He didn't become chairman because it's my essay. But he has a double advantage: easy access to my office because he's also serving as my essay, and then of course Prof can also support him from the academic side. So other members of the Technical Working Committee, let me just read it out. Dr. Zainab Shinkapi Bagudu, who is the UICC President-elect, the Director General of NICRAT, Director General of Nigeria Nuclear Regulatory Authority, the Chairman, Nigeria Atomic Energy Commission, President, West African College of Surgeons, Registrar, National Postgraduate Medical College of Nigeria, the Registrar, Medical and Dental Council of Nigeria, the Registrar, Radiographers Registration Board of Nigeria, Registrar, Pharmacists Council of Nigeria, Director General, NAFDAC, Director General of the National Health Insurance Agency, Chairman Committee of CMDs, MDs of our federal teaching hospitals, the President, Nigerian Cancer Society, President, Nigerian Cardiology Society, President, Association of Radiation and Clinical Oncology of Nigeria, an individual recognition, Dr. Yunus Agaba, Dr. Farah Tade Abubakar from UMTH Maiduguri, Dr. Lawal K. Abubakar from Abu, Zaria, Dr. Yetunde Onimole, nuclear medicine physician, Dr. Lockjohn Tamuno, nuclear medicine physician. Of course, I've announced Dr. Aliko Shinsindu, Professor Kayode Adedapo, another nuclear medicine physician from UCH, Dr. Tessie Osia Amadu, nuclear medicine physician, FMC, Abuja, Dr. Ahmed Rufai from the National Hospital Abuja, Dr. Folu Arewa, nuclear medicine physician from National Hospital Abuja, Dr. Olumayowa Kolade from UCH, Dr. Emmanuel Obina from Enugu, Dr. Taufik Ige, medical physicist, Professor Ifeoma Okoye, Emeritus Professor of Radiology from UNTH Enugu, Professor Sunday Adewuyi, Professor of Radiation Oncology, Abu Zaria, Dr. Aminu Magashi, CEO, African Health Budget Network, Ms. Clara Omatashe, CEO, GNC International, Mr. Moses Aliyu, CEO, SEPCO Nigeria Limited, Dr. Lola Adeyemi will also join as a member, and then the National Coordinator, Cancer Control and Nuclear Medicine Program will serve as the Secretary and Head of Secretariat. Let me appeal to our DGs especially that we need you to participate actively. And if you are not able to participate actively, please nominate somebody who is knowledgeable and who is going to be consistently available to represent your agency in the committee. Okay, sorry. Dr. Tolu Adewole was omitted. He's representing the NSI. Dr. Tolu Adewole, I hope he's there. All right. Before I end this address, I must thank all our international development and implementing partners, as well as multilateral agencies that have been supporting us to improve cancer care in Nigeria. Let me use this opportunity to particularly formally acknowledge the memorandum sent to the ministry by the World Health Organization, conveying the inclusion of Nigeria as a focus country for global initiative on childhood cancers. This inclusion means a lot to us, as it will support Nigeria to provide improved access to quality cancer care for children. I wish to extend our gratitude to the Director General of WHO, to the country rep, Dr. Walter Mulumbo, for this inclusion. I hereby encourage all development partners, bilateral and multilateral partners, to put Nigeria first in all their considerations for cancer care programs and initiatives. I call on all Nigerians to unite against cancers by taking personal actions for prevention and early diagnosis. Thank you, and God bless.